Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and today we're continuing our talk on perimenopause and menopause with regards to weight loss. And if we remember from that, our earlier podcast, one of the issues that can affect your ability to lose weight and to maintain a healthy weight during menopause and perimenopause is your digestion. And we're more specifically, in this case, we're talking about constipation. So, a very common thing is people they're constipated, if they go see their doctor, and then it's just, here's some laxatives, here's some Restore-Lax, and there you go. If you need it, take it. And that's fine, but it doesn't necessarily address the root problem, and it can lead to a dependency, which is even worse. So what I've noticed in practice is that a lot of the stubborn cases of weight loss where we had everything addressed and the weight just refused to move. And you know what? Not even weight loss. A lot of cases where, for instance, say headaches or fatigue and nausea and bloating, all those cases, and all the typical treatments were not getting the results what we're looking for. Turns out the person had not revealed the fact that they had difficulties with constipation. And when that was corrected, those symptoms would clear up. So the 5 tips for today with regards to constipation and how it can affect weight loss and the things to consider is, number 1, it's not just about the backed up weight. Yeah, we could oversimplify it and be like, oh yeah, of course it helps with weight loss because you've got like 4 pounds of crap in there that you got to get out. It's more than just that. Obviously that plays a factor, but it affects your weight loss even more than that. So, and I'm going to get into those with the next few points as we go. The next question is, well, what is constipation? Like, it seems obvious, but like, how often should I be going? I like people to have at least one formed bowel movement per day. You will see with some internet medicine, it's like, no, you need to have a bowel movement after every meal. You should be having 3 bowel movements a day, or maybe even more. And that's, if you're not going that often, then you're definitely constipated. Nope. You need one formed bowel movement per day. Let me swipe that off. One formed bowel movement per day, and you should feel like as if you're actually fully emptying. Like if you feel like if you're going to go to the bathroom and you feel like you're not done, but you can't go, that can count as constipation as well. But just because, as long as you're going each day and you're fully emptying, then I'm not concerned about the constipation aspect of it. Now, let's say that you're not going to the bathroom every day, and you're only going every 2, 3. I've had some people, I think the record I've seen so far is 3 weeks. Someone who only went to the bathroom every 3 weeks. So you can only imagine how uncomfortable that would be. And I know most of you are probably not at that point, but even if you're only going every other day, you will see benefits by going daily. So when I treat or have people work towards improving their constipation, I feel it's really important to take a progressive, additive approach, which means you want to start with something really simple and then build upon that to get the results. So number 1 is water and fiber. And the tricky thing is that when we're trying to lose weight, you need to be able to add fiber that's not adding a lot of extra starches, sugars, carbohydrates, empty calories to get the results that you want. The next thing is that it can't be dry fiber. A lot of dry fiber I find can actually back people up even more because it starts absorbing some of the water out of your system. So I like oily fibers, and the best thing for that is oily seeds. So things like chia seeds, hemp seeds, flax seeds, and anything where they can be pre-soaked in advance, whether you're putting them right into your smoothie, like 2 tablespoons of chia into your smoothie every day, or chia and flax into your smoothie, or you're soaking them overnight and doing like a chia pudding. And if you haven't tried that before, honestly, look it up. Chia pudding is delicious, and it definitely helps get things moving. The next step, if the fiber is not enough in your case, then because I often have patients taking magnesium at night because it improves their sleep, they feel more rested, and improves their repair from exercise. I just switch them from a magnesium glycinate to a magnesium citrate powder. And while I do prefer the glycinate in terms of giving a better effect for sleep and calming, the citrate is nice because the only side effect if you take too much is that it can make you go to the bathroom. So switching to a citrate powder, taking that before bed would be step number 2 if the fiber is not enough. After that, if we needed to do anything else, and usually that covers it. In the vast majority of cases, that's enough to cover it. But if it's a really stubborn case, then you can get into the herbal laxatives. But even that is a progressive approach. There are some herbal laxatives that you're used to seeing in pharmacies like Senna, Senna being the number one in Cascara. They definitely get things moving, but they're hard on the bowel. So you want to start with formulas, and these are harder to know to identify. But herbs with amla is a very classic herb, and a lot of the Chinese formulas for constipation, they use what's called a turkey rhubarb. And the nice thing with this is that it actually works to improve the tone of the bowel, whereas some of the other laxatives can make the bowel more dependent and weaker. So everything is always, like I said, done in a progressive approach so that you're getting the best effect by using the least amount of intervention. The fourth thing to consider when it comes to constipation is that it can actually affect your hormone levels. When the body is getting rid of estrogen metabolites and estrogen breakdown products, it's doing it through the liver, and it's actually causing you to get rid of those through your bowels. But if you're constipated and everything is just sitting there for days, those can get reabsorbed back into your system and affect your hormones. And if the hormones, as we talked about in the previous episode, are imbalanced, where there's an estrogen dominant case, that not just affects your ability to lose weight, it affects which receptors the estrogen is going to be acting on, so to make you gain more weight around your midsection. So that's just the fourth point to consider, is that constipation can affect your hormones. And number 5, it really plays a role in water retention. And I'm not sure if this is just because it's an autotoxicity from not getting rid of all those toxins, but with people with a lot of swelling around their ankles and their hands, and that water retention that you see around their abdomen, when you get the bowels moving regularly, you will see a marked improvement with that as well. So when you see the water retention affecting someone's ankles and legs, it's not just, people always think, okay, is it their heart, is it their kidneys? It's not just that. You have to think about the bowels as well and make sure that those are emptying. Even back pain, totally going on a little bit of a tangent here, but a lot of times people with backed up bowels, and they're getting this pain in their SI joint, especially around their left SI joint, and then if you ask, does it feel better after you have a bowel movement? Often the case is yes. It's just because all of that backed up matter is pushing on the psoas muscles and pushing onto the SI joints. So just an extra side note there. So even if you're thinking to yourself, you know what, I've always been this way, it was never an issue before, it's normal for me that I only have a bowel movement every 3 or 4 days, that's fine. And that's, when you're younger, you can get away with those things. It's just like you say, it's normal for me when I was a kid, I could eat candy and still lose weight. I could not exercise and still lose weight. And unfortunately, we're not at that stage anymore. So if you really want to optimize your health for the stage you're at, make sure that you're having those daily bowel movements, and you will notice an effect from that. The other concern that people have is that when they get backed up, because a lot of people are used to this pattern, they get really backed up for a few days, and then they blast themselves with a hard laxative that they receive from their doctor, and then they have a day where they literally won't leave the house, because if they have to go, they don't know at any moment if they're going to have to run to the bathroom, and it's going to be just like a tragic mess. So when you're doing it this way with the progressive approach, when we're trying to do something every day to make sure you're having bowel movements daily, you won't get to that stage where you're backed up and you have to worry about an accident. And also because it's progressive, if you ever get to the point where you're going from constipation to all of a sudden it's just loose stool, you just go back a step. So you just have to go back to the previous step, which is great because that means there's one less thing that you have to do. So if you added the magnesium and it was too much, you can reduce the magnesium, or you can just go back to the focus on the fiber and making sure that that's working. So that is something to consider. You don't have to be worried about, I'm backed up and now, I can't leave the house because I have no idea what's going to happen. So that was a little bit of an interesting topic for today. I hope this was helpful, and thanks for joining me on my commute to the clinic today. This is Doc Yates, signing out. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.